In March 2019, I was exiting a restroom on the campus of Hofstra University after having competed in a speech and debate tournament when I was approached by an elderly gentleman donning a pinstripe suit. He called out to me as I walked past him and said, "Excuse me, but are you the young man I just saw speak?" I nodded, hesitantly, not quite sure about what was going to happen next. But then, he hit me with the question universally loathed by all indecisive undergrads. "So what are your plans for after college?" At the time, I felt pulled in so many different directions. Not really knowing what to tell him, I replied, "Well, I really enjoy my English and communication classes, but honestly, I don't know." He looked at me, chuckled, and said, "In that case, you should become a doctor." I should become a what now? Did you hear what I just said, my guy? I said English. In which one of Dr. Strange's 14 million universes does the input I gave you equal the output you just gave me? And so clearly that conversation had no impact on me at all. But for the longest time, I couldn't shake this one lingering question. Why? And the answer to that question is the reason I am standing here before you today, donning this coat and sharing this message. My name is Umayr Shaikh, and I am a first-year medical student who has the extraordinary privilege of studying medicine at none other than his dream school, right here at Georgetown University. Prior to my time at Georgetown, I earned my master's in public health from the Dartmouth Institute in New Hampshire. But what may surprise you to learn about me is that before I either earned my master's or started medical school, I attended a small regional university to study a subject many physicians never get the chance to explore. In fact, here's a picture of me and my parents on the day of my college graduation. Now, it's a little hard to see from this view, but if you were to zoom in, you would notice that the text on my diploma doesn't say biology, chemistry, physics, or anything in the sciences for that matter. But instead, it says Spanish. That's because while at Butler, I primarily chose to study Spanish language and literature, creative writing, and organizational communication. Whereas many medical students might find their joy in a research laboratory, my safe space has always been wherever I've had the ability of putting pen to paper and letting the words write themselves as my hand simply moved as it was commanded. And while I've always wanted to dedicate my career to improving the lives of others, and have always believed medicine to be the ultimate act of inspiring this positive change, the traditional pre-med journey just never appealed to me. Choosing to spend my time memorizing the intermediates of the Krebs cycle or poring over the intricacies of Mendel's laws of inheritance were the last things I wanted to do with my limited free time to explore my true passions. And now, one graduate degree and almost a full year of medical school later, I have come to a very important realization about my tenure as a college student. That my humanities education taught me more about what it means to care for someone than any STEM course could ever hope to accomplish. Whether it was comparing the supernatural plights faced by heroes of ancient mythology to how we choose to understand humility and acts of service today, analyzing Seishonigen's prose about the unfair social burdens and double standards faced by women around the world, or studying how to speak with someone in their native tongue to tell them you'll be there for them every step of the way, I have come to believe with my full heart that the key to a complete and fulfilling medical education is attaining an absolute mastery over the humanities. But mastery is about so much more than just exposure. To master something means to continuously engage with it on the deepest possible level, a process that demands continuous dedication and evolution. In other words, mastery takes time, so start early. And that brings me to the thesis of this talk, that pre-health education should not only encourage, but prioritize a diverse and enriching humanities education. Let's talk about why. If you really think about it, the practice of medicine is kind of the ultimate application of the humanities. Doctors and other healthcare professionals are tasked with the ultimate well-being of the human state, preserving life. And what better way to understand the human state than to study the field dedicated to its exploration, the humanities? When providers fail to adequately analyze complex, non-concrete information and approach their patients as a set of symptoms to be resolved, rather than as a complete, multifaceted individual, patients unsurprisingly start viewing their providers as obstacles rather than allies, ultimately leading to worse satisfaction and outcomes. In fact, a recent study published in the Journal of Medical Humanities demonstrated that medical students with a humanities background were more likely to be rated by their patients as having higher levels of compassion and empathy compared to their peers without one. Given the well-documented association between perceived empathy and positive patient experience, these study findings have tremendous implications for the future of our patients' well-being. You see it when someone comes into a room, not because they have high blood pressure or because they have a fever, but because something just felt off. And when you ask the right questions and the truth starts to unfold, everything becomes clear. Her son is going through a divorce. Her daughter just suffered a miscarriage, and her husband has stopped speaking to her. This is something I have witnessed firsthand more times than I can count. And within minutes afterwards, she looks at you, sighs, and says, "I feel a lot better now." But why this discrepancy between theory and reality? Advanced communication models learned in medical school are seemingly cast aside when there are 20 patients waiting to be seen and the provider is 30 minutes behind. As a first-year medical student and occasional patient myself, this is the reality of the medicine I have witnessed. So why the discrepancy? Much of it certainly has to do with administrative burnout and physician burnout as a whole, something we will discuss shortly. But regardless, the question still stands. Why do we spend so much time learning about these things in medical school only to see them gradually fade out of application? From my point of view, the answer is simple. It's because we're starting too late. Let me tell you a story. One night, a few years back, I signed up for a volunteer shift at my local hospital, cleaning exam rooms in between patient visits, alongside a fellow volunteer we'll call Eric. Now, I had never met Eric before, but I had heard about him, some of my other shifts. He was a senior in high school who had just turned 18, and although he meant well, he frequently needed to be reminded of simple things, such as washing his hands after finishing up a room. Well, on this night, the hospital physician came up to us and asked if we wanted to come with him to see patients. We both eagerly accepted, and in we went to see the first one, whose primary complaint was a tearing right shoulder pain. But no matter how many questions the physician asked him, that was all we got out of him. He barely provided one or two word answers to every single question, mostly responding with "don't know." And even when the physician asked him to elaborate, he said, "Why? If you can't figure out what's wrong with me, then get me someone better." And right when all hope seems lost, Eric, in front of everyone, looks at the patient with a completely straight face and says, "So what brings you the greatest joy in life?" Quite the existential question for someone who came in with shoulder pain, don't you think, Eric? Well, that's what I thought at first too. But then I turned to look at the patient, and his entire demeanor shifted. His face softened, relaxed, and he started to laugh. At first a chuckle and then a full-on bellow. He looked at Eric and said, "Well, that's quite the personal question, young man," before proceeding to answer, "Bowling." After some further conversation between only Eric and the patient, while the physician and I were stunned back into silence, we discovered that his shoulder pain was, in fact, bowling related. Now, after the encounter, I pulled Eric aside and I said, Eric, what on earth made you think to ask the patient that question? And he said, well, we were reading some essays in my English class, and the author of one of the pieces said that the best way to get to know someone and earn their trust is to ask them what brings them the greatest joy in life and get them to talk about it. Holy crap! What this guy learned from reading a 5-paragraph essay is a skill some providers don't learn throughout their entire careers. Eric, an 18-year-old high school senior, before even starting his pre-medical education, had already mastered perhaps the most important skill any clinician could ever hope to acquire: earning a patient's full trust. A skill he learned in his high school English class. Do you see it? When you start earlier, action starts to become habit. While your mind is still developing, you integrate these patterns of thought in your head and apply them as the framework to construct your future. In fact, an article published by the Journal of Neuroscience in 2010 states that this concept of synaptic plasticity, or the ability of the neurons in our brain to link together in new ways and organize themselves based on our experiences, begins to significantly decline immediately following adolescence. It's the same reason why kids learn languages both faster and better than adults. Whereas many medical students and providers sculpt their basic mental framework from thought processes rooted in STEM, Eric and others like him sculpt their basic framework from the humanities, the study of mankind. And I ask you, what better basis could there possibly be for a healthcare provider? But it doesn't just stop there. Studying the humanities doesn't just allow physicians to better connect with their patients, but themselves and their identities as well. Namely, it can help aspiring physicians to understand that their identity is more than a profession. So many doctors I've spoken to cannot answer the question, what would you be if not a doctor? In a profession that already has a burnout and suicide rate more than double that of the general population, perhaps studying the humanities can help provide a bridge to help these people realize that they can be a doctor and, rather than a doctor or. And this goes beyond mere conjecture. As a study published by the Journal of General Medicine reflects these exact findings, that physicians who choose to explore a humanities-related pursuit outside of their careers, such as art or writing, experience significantly lower rates of burnout than their peers. As a Georgetown medical student, I am always amazed by the talent and soul of my classmates and the ways, the outlets they develop to retain their identity as a complete human being outside medicine. For people like me, the skills and knowledge acquired throughout my humanities education is that anchor. And perhaps the same can be said for countless others like me. Let's introduce that context sooner rather than later. And finally, let us have a realization. The season for change is now. In the wake of COVID-19, we can clearly observe that our medical system is in dire need of change. And perhaps the change I discussed throughout this talk can be the catalyst that helps transition the frigid cold of winter into the warmth of spring, infusing color into the leaves of medicine's tree. But what can we do about it? I know a lot of people certainly told me before I gave this talk, Umayr, you're a first-year medical student. You don't know anything. And they're right. My medical journey is just beginning. But that's exactly why I'm in the best place to start this conversation and initiate a meaningful change. But I need your help. What can we do together? The process of change is one that requires immense fortitude and resilience, but most importantly, it cannot happen in a vacuum. It is imperative that we encourage not only students, but their support systems, all of you, to be an active part of that change we want to see. Start by encouraging your students who are interested in medicine to explore scholarship in the humanities. And likewise, encourage humanities students who are interested in using their gifts for the betterment of people everywhere to think about a career in healthcare. Be an advocate for reforming the process, and don't ever hesitate to reach out to me to let me know how I can be an active part of that journey alongside you. Instead of staking the future of our world's healthcare on something like the MCAT, an 8-hour exam filled to the brim with every scientific topic you can think of, let's instead start truly prioritizing stories, experiences, as our future providers seek to holistically educate themselves without the fear of appearing as intellectually weak. Encourage those interested in medicine to leap into a world of humanities and imagination for themselves, their patients, and for the future of medicine all over the world. Let us all work together so we may realize the dream of bringing forward this season of change as one. Thank you, everyone.